Today's Imprint Weekly podcast is brought to you by Accenture. Change is afoot in child welfare. Change that means agencies focus on results for children and keep far more of them safe at home with their own families. Accenture's child welfare team is leading the way in the effort to ensure technology does its part in that success story. Accenture offers cutting-edge case management tools that ensure agencies can see insights that drive decision-making and caseworkers have information they need at their fingertips. Together, these tools help agencies stay laser-focused, reinventing child welfare into a source of strength for families when they need it. For more information, visit www.accenture.com/child-welfare.
Hello and welcome to the Imprint Weekly Podcast. I'm John Kelly, Senior Editor of the Imprint, a daily news site covering child welfare and youth justice around the country. You can read all of our coverage at imprintnews.org or check us out on Facebook or Twitter at the Imprint News. You can also sign up on our homepage for our free weekly and monthly newsletters. And for professionals in child welfare and youth justice, subscribe to our Youth Services Insider section for a closer look at news on business, policy, and practice. We're going to go for full headlines today, no guests, so it's going to be a fairly quick one, but soon, I want to promote this first. We'll be featuring many more podcasts than just this one on Safe Camp Audio, which is Fostering Media Connections' new podcast network featuring great audio projects on child welfare, youth justice, and more. Does that mean more podcasts from us here at Fostering Media Connections? From the Imprint? That is definitely the plan eventually, but we are starting this up with a team of inaugural members who are already doing great stuff in this space. So just a few examples. We've got Unbelievably Resilient. I've talked about them a couple of times on the podcast. We had one of the co-founders of it, Carrie Richmond, on the podcast pretty recently. This is a group of former foster youth that are just putting out, just in my opinion, really the best podcast in this space. They just have tremendous conversations centered on storytelling, topical things. The first two episodes of this season of Unbelievably Resilient have come out already. I think episode 2 is my favorite, where they're talking about accessing case records, reliving their history by looking through old documents and things like that. It was very powerful. We've got Audio Nuggets, which is hosted by Corey Best, great thought leader in this field. Tremendous conversations. He's really just getting that started up. And Children's Law Podcast. That's probably the first podcast on child welfare or really anything in this kind of space that I heard. And it's just, it's a group of lawyers who have represented children in child welfare proceedings for years and years. And, there's plenty more examples, and we'll have much more information very soon as we move towards a launch in May of this podcast network. But, I think those three podcasts in particular just really epitomize what we're trying to do in year one as we launch this. Well, we're hoping will be a hub for really great audio content. I mean, these are three podcasts that I just named, completely put together, crafted by people who have entire other day jobs. This is something they do largely out of love, largely mission driven, but really not paying the bills, And, our hypothesis here is that anybody is going to benefit from added promotion and dissemination. And that's something that we are in a position as a media company to do. So we're going to start, the crawl year will be, of course, we're going to keep cranking out the Imprint Weekly Podcast, and we're going to work with these podcasts to see, can we raise I was going to say eyeballs. That's not really the case for most of them. Raise the level of ears, the number of ears who are downloading and receiving these shows. So stay tuned for more details on this, safecampaudio.org, and it's going to be Safe Camp Audio on all the social media feeds as well, as I have been for the last couple of weeks. I will drop the link for anybody who wants to join our very light touch newsletter, which we will be sending out with updates from all of our inaugural Safe Camp members kind of periodically to let people know what the new episodes are on all of these shows. All right, let's do some headlines. We're going to start with some new data compiled by the Annie E. Casey Foundation for its most recent installment of Fostering Youth Transitions. So here's the biggest takeaway, and I'll drop a link to the study and the little write-up that we did for subscribers on it. Biggest takeaway, in my opinion, I knew from our own work on the Who Cares projects, where we kind of regularly collect both federal and state directed data on everything from the number of licensed foster homes to the number of kids in care and demographics and all that. I had a sense from that the share of foster youth who are older and by that I generally defined as above 13 years old, has gone down in the past decade or so. But man, it has really gone down when you look at the numbers that are part of this new iteration of fostering youth transition. So the report uses 2006 as a kind of 10 posts, of history, because 2021 is the most recent federal data that we have available for most things on foster care. In 2006, there were 271,000 foster youth between the ages of 14 and 21. And I would add, because it's going to make the more recent data more dramatic, I think, in a way. When you say 14 to 21 in 2006, there were really not a lot of youth in foster care between the ages of 18 and 21 back then. That was before Congress had passed the Fostering Connections Act, which enabled states to kind of tap federal money to extend foster care. There were very few. I feel like for sure Illinois had extended foster care, I think 21 by 2006, but I'm not sure anybody else had. There were certainly some youth who were allowed to stay in different procedures and policies past 18, but that is mostly a more modern phenomenon than 2006. So all to say, there were 271,000 foster youth between 14 and 21, and most of them were between 14 and 18 years old. Okay, so that's 2006. By 2021, the total was down to 147,143 youth. So again, I'm terrible at math. That's about got halved in those 15 years between 2006 and 2021. And the percentage is also down. So I think that's a relevant point here, is there's actually less kids overall in foster care than there were in 2006, quite a significant drop. So on one level, it'd be, reasonable to say, okay, yeah, of course there's less older youth because there's less youth, period. But in 2006, youth between 14 and 21 represented 53% of the youth in the system. So more than half of the kids in foster care in 2006 were above the age of 13. They were 14 and 21. By 2021, those 147,000 and change youth in foster care that are older represents 38% of the overall total. So guess the overall number declined somewhat, I guess, in proportion to a general decline in the use of foster care, or the number of kids who are in foster care. But it also is the case that we have dramatically shifted what foster care looks like in terms of age. It is much more about younger children today than it was 15 years ago. The report also kind of surfaces some other trends that are interesting and maybe not so good. One is that we've actually gotten a little bit worse in the recent years. So they didn't have data going back to 2006 for this, but they did offer a comparison between 2016 and 21, so a 5-year window. We've gone down a little bit in the number of youth between 14 and 21 who ultimately exited the foster care system into a form of permanency. And I would define that, as most people do, as generally reunification, placement with a kinship, caregiver, guardianship, or in a kin gap situation, adoption. And then the fourth path out of the foster care system, which is not permanency, would be aging out. So in 2016, there were 48% of youth between 14 and 21 who ultimately exited to permanency. So 48% in 2016. In 2021, that was down to 44%. And the percentage who aged out into adulthood increased from 46% in 2016 to 52%. So not completely tied into this report, but I think it's worth noting that one piece of kind of what Annie Casey Foundation does, in addition to a lot of data and research for the field, is they operate the Jim Casey Youth Opportunity Initiative, which has historically, it used to be its own standalone program, but it focuses on, supporting older youth in foster care. And they've got some fellows every year that work on policy for them. And recently, alumni and existing members of that policy team, or the fellowships that they run, have come up with a different path to permanency for young people who have experienced foster care and are facing a transition into adulthood without, the traditional forms of permanency that we know. It's called Soul Family. And I'm going to link everybody in the show notes to a really great interview we did on the podcast. It must have been about a year and a half ago now, with Leslie Gross from the Casey Foundation and Patty Dew, who was a fellow for Jim Casey and is now actually on the Casey staff. She aged out of foster care, and they can break it down much better than I could in terms of the kind of salient details of what the soul family concept is. But on a basic level, it's empowering a young person who's facing, aging out of the system to sort of legally set expectations for certain adults and people in their lives. So they basically get to kind of create their own permanent support unit, whether that's, a teacher or a coach doing one thing for them and sort of having that legal expectation, and, maybe a relative who's there to do another thing for them. And so it's a little bit more of a youth-directed path to permanency. And so, Kansas has kind of committed to working with the foundation to bring that soul family concept into code. That hasn't happened yet. Been told that, next legislative session for next year is probably when that will happen. And it'll be interesting to see whether they're the first, and whether there gets to be more interest in things like this from other states. Okay, another interesting kind of research-born storyline for you guys. When a baby is born exposed to opioids in this country, the most common way of deciding whether and how to treat the child is called the Finnegan Neonatal Abstinence Scoring Tool. I promise you don't have to remember that for the rest of the conversation about this, the Finnegan tool. And often, it will result in a stay in the neonatal intensive care unit for the baby, along with a tapering dose of methadone or morphine if they start to exhibit withdrawal symptoms, which can be painful. So a study published recently in the New England Journal of Medicine found that another approach to doing this, called the Eat, Sleep, Console approach, that hinges on very close contact between baby and mother, as opposed to a separation where the child's going to the NICU, involves far more judicious use of medication for babies, has shown pretty promising results. So, according to the study, when the Eat, Sleep, Console approach was used, I guess this was a comparison group between two, babies required treatment with opioid medication 69% less often, and they spent in total an average of 6.7 days in the hospital, as compared with more than 14 days for a comparative group that were treated under the Finnegan tool protocol. And reading this made me immediately think of another alternative approach on this issue, which is becoming a more prevalent thing in hospitals, right? Fentanyl, we all know, has become a huge problem in this country. And so more children are being born, potentially exposed and experiencing withdrawal symptoms from opioids. But all to say, reading about this study made me think of another alternative approach that we covered in the Imprint about 5 years ago, and that's called MAIN, which stands for Managing Abstinence in Newborns. It's out of South Carolina. Dr. Jennifer Hudson was one who came up with it. And, a study of that program found similar things: less days spent in the hospital, way less days spent in intensive care. And what's interesting is that the MAIN approach features one completely common element with Eat, Sleep, and Console, and then one completely opposite thing. So just if I could explain for a second, when we talked to Jennifer Hudson about this, Dr. Jennifer Hudson in South Carolina for the Imprint, what she described as the main tenets of MAIN is that, when the child is born, their theory was, why wait around to find out if the baby is in serious withdrawal? The majority of babies are going to experience some form of withdrawal. So let's proactively treat with opioid medication and get ahead of that. And yeah, you will probably provide opioid medication to some small number of babies who didn't need it. But at the same time, so that's very different, obviously, than the Eat, Sleep, Console. Eat, Sleep, Console is more conservative about the use of opioid medication management than the normal protocol is in America. So this is being more aggressive and just sort of getting ahead of it and assuming that the baby will experience withdrawal. But the common element is that close contact with mom. It's the not having the child, unless it's absolutely necessary, go into a NICU and spend that time bonding in the hospital with the mom. So, at the end of the day, two alternatives to sort of status quo yielded better results in terms of less days spent in the hospital, less money spent by the system. And they took a totally different view of how to, factor in medication to manage withdrawal symptoms, but both are built around the idea that it is a bad idea for separation in those early days after a child is born, to have them be separated from their mom. So, both Maine and the Eat, Sleep, Console approach, they got better outcomes per these research studies by making sure that mom and child have close bond and ability to be together, in the hospital in those early days. All right, so that's your research news for the week. And now I just want to riff on a few really great pieces of reporting that we have had featured in the Imprint of late, starting with high stakes silent systems. So this Imprint review of 50 state policies and interviews with all kinds of current and former foster youth, child welfare experts, officials in the state and county level, legal advocates, revealed a very troubling lack of critical guidance when it comes to decisions and assistance for youth who are in foster care around everything ranging really from just sexual health and sexual education all the way to decisions and access to abortion if that comes up in their case. I'm not going to talk too much about this because I'm going to have Michael Fitzgerald, our reporter who handled this investigation, on the podcast. I think next week. We're going to shoot for next week to talk about this. There's also a second part of the series coming this week, and then I think a third one in the subsequent week. But the first one is out. I'm going to put the story in the links. And man, it is really an eye-opening look at just how erratic, the conversation or the guarantees of sexual education, sexual health, reproductive justice are for youth who experience foster care in this country, including some instances where it seems that the rights and access of foster youth is kind of subjugated below what is provided to other youth in the state. And I'm just a little teaser. This is a quote from Amy Dworsky, who's a research and policy expert with Chapin Hall. This situation looks ripe for a lawsuit since in some states, young people in foster care appear not to have the same rights to reproductive health care as their peers who are not in foster care. So there you go. We'll have Michael on pretty soon to kind of go over the story way more in depth. All right, another one out of the Imprint. This is a story under the headline, The Untold Story of How a Stubborn Group of Parents Helped Shutter the Nation's Largest Youth Prison System. So this is about California, and if you haven't been reading us on this, California is just about a month away from entirely shuttering its state-run youth prison system, which currently has very few children in it, or even young adults. And in recent years, really hasn't had many more than, about 500 kids incarcerated in these state-run youth facilities. Most youth who are incarcerated in California that is done at the county level now, which makes it easy to forget that at some point in the very not distant past, there was an enormous state-run youth incarceration complex in California that was home to 10,000 young people at a time. In 2004, there was this, basically starting in 2004, there was this year and a half long stretch where 56 teenagers attempted suicide in these facilities. And Nell Bernstein writes for us on pretty much as the headline indicates, this untold story of how the ball got rolling from that point where there were 10,000 kids locked up in California facilities to the point where they are going out of business. They're putting themselves out of business and ceding all this to the counties right now. And it began with a group of parents who came out to protest the overuse and horrendous conditions within those really overcrowded facilities at the time. And one of the slogans that, became prevalent in those early protests was books, not bars. An obvious, tip to the idea of let's actually invest in young people and their development instead of throwing them all, into facilities with no good conditions and nothing going on in terms of pro-social development or education. And so Nell really tells the story of both how that group stayed together in some form or another and really has kept the pressure on California for decades now, but also just how those early protests, really got that concept of books, not bars, which you'll hear in many more states now than just California going. And, it's just, it's interesting, of course, to anybody in California, but it should be of interest to anybody who sees overuse of incarceration in their state now, or suboptimal conditions, or a state that's kind of intransigent about rethinking how they would, work with young people who are involved in the youth justice system. This is a story about how one group of grassroots, activists who are all parents got things rolling to the point where now there will not be state-run prisons in California for youth. Next one I want to call out, going up the coast a little bit from California, is Washington. So Washington State settled a lawsuit last year. Was it last year? I'm pretty sure it was in 2022, agreeing basically to do something about the fact that there were many youth in their foster care system for whom they were failing to find any sort of suitable placement in residential, in foster care, with kin. They were failing, and these kids were ending up sleeping in offices, or they were sleeping, in some cases, as we wrote about in the Imprint, in cars with caseworkers. That was not as prevalent, certainly, as offices. And then the most common outcome was getting, these kids getting shacked up into hotels with each other and living in hotels, which, by the way, the state was paying absurd amounts of money to staff and have caseworkers, just watch over these kids in hotels, or paid, one-off foster parents like there were Airbnbs, at exorbitant rates to make sure that these kids had somewhere to stay. So they settled, and, we're seeing the first details, as reported in this story, of exactly what the plan is going to be to try and get out of this, which I think should be something that other states keep an eye on, because Washington is certainly not the only state that has, experienced some bad headlines and actually really struggled internally with, a number of kids, a lot of kids, too many kids sleeping in offices or hotels. So a few details on kind of what they're thinking about and where they're going to invest some money to try and change things. One is to invest a little bit more in some kind of special supportive independent living units for older youth. I think that's nothing new to a lot of states have something similar to that. Another part of the approach is going to be to expand the hub home model, which was invented by an organization in Washington State called Mockingbird. And generally, you can read a little bit more about this in the story if you want, but really, what that entails is, this network of foster families or kinship caregivers who live in close proximity to a more experienced foster parent who's able to kind of provide the support on the fly to those other households. So the theory is, if you've got this cluster of caregivers and they are all in close proximity to, somebody who is resourced and experienced and wise in the ways of sort of troubleshooting crises as they come up, you're going to do a lot better in terms of stability. You are not going to have the kinds of problems come up with young people, some of whom have really, some serious challenges with past trauma and behavior. You're not going to have those things flare up to the point where, somebody's calling the state or the county to say, come and get this teen from my house. I can't deal with it. So that's another part. And then the other piece of this pie for Washington State is to try and get a larger class of professionalized caregivers who at least one of two people in the household would be agreeing to stay at home entirely, not have another full-time job, and serve entirely as essentially a professional foster parent and have a much higher level of training. You hear this referred to, and quite often, as like therapeutic foster care. I think what they're aiming for is maybe even a level above that. So having that specialized training, but also having no day job to worry about or nothing else, but a focus on caring for youth who have pretty high acute needs. So we will continue to report on that as the plan rolls out. But that is what's going on in Washington. And like I said, they're not the only state that's got that. I think the sort of big picture here too is, the Family First Prevention Services Act, which we certainly devoted quite a lot of ink to with the Imprint and talking about on this podcast, in and of itself was never going to solve every problem in child welfare. But certainly the gambit of what Family First has is, we're going to make it a little fiscally harder for you to choose using congregate care and group care for a child, often an older child, by limiting your federal money there. But that's okay in the long run, because we're giving you more money to invest in strategies and services that will help you reduce the number of kids who need foster care at all. With in reality, there's always going to be some transitional period where the limits on congregate care, if they worked, if limits on federal money actually, lowered the use of congregate care. And by the way, I don't know that the jury is in on that actually happening. I think there was already a decline in congregate care, and there's a lot of people that will say, Family First caused the decline in congregate care. I think that was already happening, and it's kind of very murky as to whether those limits are actually yielding any sort of real decline in the moment right now. But there was always going to be this situation where, the investment in front end services to prevent foster care were not going to work overnight. And so if you're not using congregate care, you got to use something else that can be kinship caregivers. You got to invest in that, or it's going to be in either more or higher quality, or probably both, in the foster care array. So I think what Washington is facing here and strategizing around is probably something that we're going to see a lot of states have to contemplate. So perhaps they are a canary in the coal mine for what's coming elsewhere. And last but not least, I want to call out two stories out of our Minnesota Bureau from Faramina. In January of last year, Minnesota passed a law that grants parents the right to legal counsel at all stages of the proceedings that went into effect in Minnesota last year. Before that, Minnesota judges really had the call as to whether there was a necessity to appoint an attorney for a low-income parent when they were involved in a child welfare proceeding. So they basically went from a state that had one of the lowest thresholds of guarantee of counsel to potentially one of the strongest ones. So now, as Mina reports in this subsequent legislation here, now that everybody's, kind of guaranteed counsel, is to sort of chip away at some sort of inefficiencies and inequalities across the state in sort of how the legal process proceeds for parents. And one that they've taken on with legislation that is yet to pass, still kind of moving through, I think, is a bill that would ensure that parents can effectively exercise their right to appeal a termination of parental rights, which is obviously a very critical and dramatic point. When parents have their rights removed entirely by a court, their last sort of opportunity to appeal that, seems to be a kind of a patchwork thing in Minnesota, where there's no real consistent statewide process for how attorneys are appointed or how appeal orders are going to go. This legislation would essentially statify that and really establish the centralized office to make qualified appellate attorneys accessible under what become pretty short deadlines to appeal. Because in Minnesota, the appeal of that termination of rights has to be filed within 20 days of a court order, which is a very small amount of time. When it's a confusing situation, it can be enough time. I guess is the theory here. If there's some sort of centralized office that parents can know to go to, and if they believe that they have wrongly had their rights terminated, appeal. The other thing about this story, though, that's really great is it covers the bill, but it also looks at this organization or this project called Stronger Together, which is it may be a unique program in the country in that it focuses this support group for parents who have lost their parental rights. And I'm just going to, as a teaser, here's a quote from one of the parents who talks about, sort of what the impact has been of this group in Minnesota. Once there's other women that are going through the same thing as you, there's something really strong about that. Getting together with broken hearts where we can understand each other. It's a lot of women that are grieving motherhood. There's just a lot of grief involved, and it's always there. So read that story for the information about the law, but also for what they're doing with Stronger Together. Okay, and final thing for this week, we've discussed on the podcast before the fact that Minnesota was moving towards becoming sort of the second sanctuary state for youth who are in search of or are receiving gender-affirming care. So for transgender youth that are in that situation, California became the first state. And so in the past few weeks, Minnesota has officially joined California here. California, by the way, became a refuge state in the summer of last year. And now Minnesota has signed off on becoming the second. So what it means for these states to be refuge is essentially that, if a young person wants to get gender-affirming care, they can get it, obviously. That's the basic threshold of becoming a refuge state. And certainly there are other states where gender-affirming care is obtainable by youth. But then also for states that have banned gender-affirming care or are limiting access, California and Minnesota are essentially saying, we're not playing ball with you. If you come looking for information about kids from your state that have come here to get treatment of any kind in this realm, we're not going to be engaged with you on any level. I'll drop a link to our story in there. I'm also going to drop, though, just so for the context here, so you understand why it's becoming important, on one level for these refuge states, or the motivation behind the passage of refuge state legislation in both Minnesota and California, is just how many states in the last year alone have moved to either outright ban or minimize access to gender-affirming care of various kinds for young people. So I'm going to drop a link from MedPage today, a really good mapping of this. So far, 19 states, according to their work, have taken some action to limit access to gender-affirming care for transgender youth. 5 of those states have actually made it a felony for the medical provider: Alabama, Idaho, Oklahoma, Missouri, and North Dakota. In those 5 states, the laws that are on the books, mostly have been passed this year, make it an actual felony to provide the gender-affirming care. I guess I'll say I was a little surprised to see that so many states had moved to legislate that harshly around it, because Alabama was the first, I believe. Arkansas was the first to create some sort of felony, if I'm not mistaken, and they were taken to court pretty promptly by the Department of Justice. I see that they have passed a kind of lighter touch law, if that makes any sense, that has the limits but not the felony stuff in there. But Alabama was the next state to go, and they promptly got hauled into court. So those are pending. It's kind of weird to then go and pass a state law you're not sure is going to hold up in court. But, I think there's like a red meat aspect to some of these, not to editorialize too much. And I think part of the process is really to just get the law passed and say you did it. So in addition to these felony thresholds in those 5 states, the other ways that penalties are structured for the provision of gender-affirming care, I mean, some of these laws, get passed with no penalty. So it's kind of unclear what exactly the impact of even passing it is. Another, penalty you'll see in these laws is creating a window for the patient or the guardian of the patient to bring litigation against whoever provided the care. And then the other more prevalent, I would say the most prevalent, is, that the medical provider's license would be in jeopardy, subject to suspension or revocation, or very large fines attached. So again, I'll put the link into the MedPage, mapping, reporting. They did some very good explanatory journalism on exactly where these things stand. All right, that's going to do it for us today. Safe Camp Audio coming soon. Lots of great podcasts on child welfare and youth justice. safecampaudio.org. Safe Camp Audio on your social media. I'm going to keep banging this drum. We're going to get lots of more people to listen to these great podcasts that are out already. This podcast is produced and mixed by Christine Onjoko, with music by Luke Giroux and Cyrus Elia. If you enjoyed this episode, we would love it if you consider subscribing or giving us a 5-star rating on Apple, Spotify, or wherever you download your podcasts. And we would really appreciate if you consider supporting our work here on the podcast and in print. Small donations from our listeners and readers go a long way towards helping us grow and cover more great stories in child welfare and youth justice. To support us, it is super easy. You just go to imprintnews.org/donate. You can follow the Imprint on Twitter and Facebook by searching the handle @theImprintNews, and visit us on the web at imprintnews.org. You can email us at tips@imprintnews.org. I'm John Kelly, and we'll see you next week.